Ear infections are pretty common in kids. We especially see them in the winter.
And they can be very painful. Look at that little guy. Kids might also have a fever, trouble sleeping, maybe some temporary hearing loss.
Dr. Gigi Chawla, the chief of pediatrics at Children's Minnesota, here to explain what parents need to know. It's the worst, isn't it?
It is. You feel so bad for them, too.
They're in so much pain.
Right.
Are they in that much pain, or is it?
Well, yes, they are.
It's bad.
It does, but
there's something about that spot in your body that's extremely painful.
And you know what happens is a cold usually starts this process. You get really congested. You produce a lot of mucus. That mucus is trapped all the way back up to the middle ear, and it's in a closed space behind that eardrum. Now with bacteria able to grow, so it's expanding in that closed space, and you feel that pressure of pain. So Tylenol, Motrin can be super helpful for that pain.
That pain is hard, and sometimes when they're really little, you don't know what the problem is. And you bring them in and you say, hey, doc, can you look at this? I suspect, but it may or may not be the case.
Right, and that's when we can take a look at the ear and see, is it red? Is it thick? Does it look like there's mucus behind it?
So when they are that little, what are you looking for? Not sleeping, just cranky when you're not sure why?
You know, I think the general symptoms are irritability, fever, just an inability to settle would be, those would be some of the things that should bring you in. But, you know, I think there are many ways that we could think about both preventing ear infections. So vaccines prevent ear infections, the flu vaccine, pneumococcal vaccine, and Hib vaccine, all could prevent ear infections. But also other strategies to think about reducing your risk for an ear infection. You know, unfortunately, getting a cold is probably your most common thing. So good hand washing, minimizing daycare as much as possible, decrease smoking to decrease that irritation can be also really helpful.
We've both had friends who've had kids who have had so many ear infections. Talk through kind of the decision point that parents have to face there.
Yeah. You know, I think probably the first decision with each one of those ear infections is, do you treat or do you not treat?
That is my big question. Do you? Because, I mean, we're talking about antibiotics after antibiotics after antibiotics.
If you start antibiotics, please make sure you complete your course so that you don't create more resistant bacteria. But otherwise, there is this period that we call watchful waiting, where you can spend a day or two trying to understand, is your body going to get rid of this on its own? Because it's a viral process like a cold. Your cold will get better on its own too. If not, you know, the pain continues to increase, the fever and irritability persist, you should go ahead and treat, but complete out your course. Now, if you have a child who's had 6 ear infections in a year, that's about our criteria to say you need to be evaluated by the ears, nose, and throat surgeons to see if there are alternative treatments.
Like tubes or something
Yes, ear tubes to really reduce that pressure.
No fun, but they work.
No fun.
They do. All right, Dr. Gigi Chawla. What do we call it? Mindful waiting? Or?
Watchful
waiting.
I like
We've
that.
done some
That's
watchful
good.
waiting.
That's right.
So it's worked in our favor. So
Very
mindful
good.
waiting.